Public Health, the Clinical Services Division Administrator there. And we're excited to be here at Madison Memorial Hospital this afternoon to administer the first COVID-19 vaccine in our health district, and potentially even the first dose in the state of Idaho today. So I think we're ready.
Dr. McEwen, do you want to tell us why you're getting this vaccine?
As a ER physician working on the front lines, working with a lot of COVID, this is a vaccine that we've been waiting for a long time. So it's definitely something we need to see, we need people to be able to do, and I want to be able to show the example that it's not something to be afraid of. This is going to help us. We really need this vaccine on people.
Does it have a live virus in it?
That I don't think.
It does not
It's
have
not
a live
live
virus.
virus, no.
And it doesn't have a dead one either, right?
What?
It's
No.
not a virus at all.
It is not.
There are some side effects over the first day or two, just kind of achy stuff like that, but nothing usually severe. So it's pretty mild, pretty typical vaccine type thing. So I'm excited.
Yes, I'm the hospice director. So a hospice is someone who takes care of most of the inpatients and ICU patients who have been treating COVID patients for a good 4 or 5 months. We lag behind the rest of the nation, but seeing COVID patients on a regular basis now.
After you get the vaccine, will you still be wearing a mask?
Absolutely. Yep.
Sorry, you can go ahead. Please.
How many COVID patients do you think you've taken care of over the course of?
Yeah, we're probably between 75 to 100.
Wow.
Seen quite a few already. So.
Yeah.
All right.
Thank you.
Yeah. Thanks, Dr. Clark.
I'm Danny Wilson, and I'm a floor therapist, respiratory therapist here at the hospital.
Has it been pretty busy with COVID?
It's been steady. It has. And it goes up and down, and we're, like Dr. Clark and Dr. McKeon, we're right directly involved with patients that are possibly positive or positive. We directly are involved with them, and so I'm 100% behind this vaccination.
You excited?
I am. It's going to do what we hope it will do. It's going to slow this thing down.
Thank you, Danny.
If someone has gotten COVID, do you recommend they still get the vaccine?
That I don't know as far as.
So the recommendations are currently being released from the CDC right now, but there are recommendations even with COVID to still receive the vaccine. And you can find those on the CDC website. That information's coming in, today and yesterday. So yeah, look for that on there as well.
Thank you.
Hi, Dr. Zoll.
Howdy.
Yeah, sure.
You can see my smile. We got the same side effects.
There you go.
You might introduce yourself, Dr. Izzy.
What's that?
Let them know who you are.
Oh, Jeff Stone, who's been on practice, old stuff on the staff. Seen hundreds of thousands of patients. Some days, everybody we test for COVID are positive, so we have a lot of exposures. And I suspect there's people that we see that are positive that we don't test. So I'm right at the pinnacle of risk. Officially, I've dodged getting COVID. Now that I have the vaccine.
Thank you.
I know you're.
What's your
Michelle,
name?
do you want to introduce yourself?
I am Michelle Rumsey. I am an RN on the ICU med-surg floor. I've been taking care of COVID patients since the beginning of in the hospital. So I'm excited.
Gonna have to pull her sleeve.
For 41 days?
That's the instructor. Yep.
What day is that?
My ears.
So is there a window? Yeah, there's a window.
Yep, thank you.
Do you guys have any work with the storehouse or any other home?
Yeah, I have a question. Just why the public needs to know that they can't just run down here and start getting vaccinated.
So vaccine right now is very limited, particularly their doses are very limited, and so they're going to high-risk groups. Currently, that's hospital staff. So as we move out to healthcare workers, then we'll start to move to those other tiered groups. And when those vaccines become available more to the public, we'll have that information out as well.
How do you personally feel being one of the first to inject people with the COVID vaccine?
I'm excited. You know, I've been in public health for 26 years. I went through the H1N1. I've even seen other vaccines like Hib, Haemophilus influenza, decrease disease just even in my own nursing career. So no, I'm excited. I'm excited. This feels like a beginning to the end, of a long year to me as well. So excited, very excited.
And to clarify, so this is maybe the first COVID vaccines here in Idaho?
It could be. There was
Okay.
two shipments of Pfizer vaccine to the state today. So one to our health district, and then one to a hospital in the Treasure Valley. So I'm not sure if we were the first one that started vaccinating or not, but yes, likely that these were the first 5 doses given today.
What would you say to people that are hestant to receive the vaccine?
Hesitancy is not bad. I would say do the research. There are some few side effects on day 2, day 3, but know those things. Be aware of those things, but make an educated decision. After everything I've read, I'm not hesitant to get the vaccine and will, but don't base your decision on a meme that you read or another story that somebody shared. Base it on good, solid scientific education.
What kind of side effects can people affect?
So
they can
that
expect?
the most reported was pain at injection site. But no, on day 2 and day 3, they're seeing a little bit of body aches and sometimes a fever with that. In perspective, much less severe than the COVID disease itself.
What's a resource that you trust?
So for me, CDC, a lot of the information's out there, and I know some people that's less trusting. They can go to Pfizer's site as well. And again, remember, they're already giving this same vaccine out there nationally, a couple days before us as well. And so some of those other countries have sites, the World Health Organization as well. But CDC definitely is moving information very quickly, being transparent and getting that information out on their website. We're also, the Idaho Immunization Program, the state website also is getting information up on it as well. Quickly as it becomes available. It was a busy weekend for us this weekend.
Is there anything else you'd like to say to the community about COVID?
No, again, this feels like the first step towards getting us back to a world where we were a year ago. So just very excited.
What's the first thing you'll do once restrictions get lifted?
I go to the Oregon coast. I just want to go out there and spend a week with my feet in the water.
Thank you so much for all that you're doing.
You're welcome.
If you guys have any further questions, Dr. Clark would be happy to answer any of those.
Yes.
I'm happy with any of those. So.
Actually, Dr. Clark, I am going to ask you some questions. Can I just come over here? So, if you don't mind. So I just want to reiterate some of the questions that we've already asked, but for people that are watching now. Do you recommend getting a vaccine? And if you want to come over here too, Amy, that's fine too. Do you recommend getting a vaccine if you've already had COVID?
Yes, I believe there's a benefit to the vaccine. Some of the studies, I read a study from Britain looking at people who've had COVID, and out of 16,000 people, only about 2,000 people developed antibodies. And so some of those people are at risk for potentially getting COVID again. We don't know. So my thought, the safer thing would be to get vaccinated even if you've had COVID, because the vaccine gives a better chance of your immune system being able to prevent another infection.
And how does the vaccine itself work?
The vaccine is as I believe it, it's an RNA nucleoside that codes for one of the proteins that the COVID virus has. And as I mentioned earlier, this virus is similar to 3 other coronaviruses that we've known about, so we had a head start on it. But they've been able to identify a protein that's very specific to the COVID-19 virus, and it makes it so your body can recognize that. It's what they call a spike protein. And the vaccine makes it so your body can recognize that and fight it before it actually causes a full-blown infection.
And so that means that there's no actual virus in the vaccine itself.
Yes, it's not the full virus. It's just a particle of the virus, just the part that codes for the spike protein.
And I am going to ask again, just to make sure, what are the side effects of this vaccine?
Yep, sore arm, fever, fatigue, mild headache. Most of those were termed mild symptoms and usually lasting 2 to 3 days.
Okay. Is there anything that you want to say to the community?
I'm just thrilled that this is out here. I'm grateful that this has happened so quickly and that we've been able to get to this point. Pretty fascinating that we can have this opportunity to be able to get the vaccine, that it was developed, that it's been tested, over 44,000 people in the first study. So a lot of people have already received this before us in the study phases of it. And I think this will make a big difference if we can get people vaccinated to get rid of this pandemic. I really hope we can make it go away, and this is a big step towards that.
We have a question from one of our followers, Jess Gowdy. If there are side effects to this vaccine, would it affect the hospital to have these recipients all down at once? What is the expected rollout process? So, how are we going to vaccinate all of our staff, I think is what she's referring to.
We're going to roll it out over a week, and where the symptoms happen within 2 to 3 days. For example, there's 2 of us that are hospitalists that work doing my type of job. I got it today, the other hospitalists will probably get it on Friday. So give it enough time that I'm clear not having any side effects or symptoms by the time the next person in my department gets it. And probably similar with the emergency department, rolling it out, so we're not going to vaccinate all of our ER physicians on the same day. We're going to roll it out over the next week.
Does it worry you how fast it's been developed?
It does not worry me. If this was a completely new virus, I might be concerned. But I keep going back to the fact that this virus is so similar to the MERS virus and to the COVID or the coronavirus 1 that came out that caused diseases back in 2007 and then I believe 2013. There were already researchers working on this, so we knew a lot about this class of virus, and it was some minor changes that they had to do to be able to get a vaccine for COVID-19.
Okay. Do you have any other questions?
Thank you so much. Thanks for all your work.
Thank you all for all your help. We know you've been doing a lot with COVID, and it's going to be nice if everybody takes the vaccine. I do see. I'm excited about this myself. And I've seen what you guys have put out, and it's really great information. So thank you for all that you do.
Thank you. Yeah.
Thank you.